Delayed onset muscle soreness, also known as DOMS, occurs with repeated exposure to eccentric muscle contractions or to unaccustomed exercise. Although several factors have been suggested as possible causes of DOMS, there is not one clear and satisfactory explanation. One theory suggests that DOMS is caused by myofibril tears, also known as muscle strains. The microtrauma results in an inflammatory response with intramuscular fluid and electrolyte shifts. Muscle tension developed during eccentric contractions may precipitate mechanical disruptions of myofibrils and connective tissue, which triggers an inflammatory response. According to Yeager and Imtiaz, other hypotheses for mechanisms of DOMS include the lactic acid theory, muscle spasm theory, connective tissue damage theory, muscle damage theory, inflammation theory, and the enzyme efflux theory. Symptoms associated with DOMS include general muscle soreness and is associated with tenderness, pain, and impairments in muscle function that may interfere with training capacity and athletic performance. DOMS is characterized by prolonged muscle strength loss immediately after exercise, in conjunction with pain and discomfort that increases within the first 24 hours, peaks between 48 and 72 hours, and completely subsides after 5 to 7 days post-exercise. Although there is little understanding of the causes of delayed onset muscle soreness, there have been numerous studies in different approaches in the treatment of symptoms for DOMS.
The first treatment for DOMS is cryotherapy and cold water immersion. DOMS should be treated initially with active rest and anti-inflammatory measures such as ice. Control states that cooling and especially cold water immersion significantly affected DOMS symptoms as compared with control conditions after a 24-hour recovery. Cold water immersion for 11 to 15 minutes can be better than passive recovery in the management of muscle soreness. Another treatment for DOMS is stretching. Many people stretch before and or after physical activity to prevent injury, reduce pain after exercise, or enhance their exercise capacity. For many years, static stretching has been recommended as a way to warm up the muscles at the beginning of training to prevent DOMS. But there is no evidence supporting this claim. Stretching has no beneficial effects on stopping DOMS, but it has been shown to prevent injury.
Continuing, another form of treatment includes supplementation and herbs. It has been found that branched chain amino acids, or BCAA, intake in strategic phases throughout the day reduces DOMS caused by eccentric high-intensity exercise. Evidence has shown that taurine, citrulline malate, N-acetylcysteine, and glutamine intake can contribute to DOMS reduction. Researchers seem to favor the application of herbs in the prevention and treatment of DOMS. Furthermore, acupuncture can be another form of treatment for DOMS. Acupuncture has been known to treat pain and dysfunction in a number of musculoskeletal and inflammatory disorders. Therefore, it is conceivable that it could also be a potential treatment option in DOMS. Although it has no significant effects on mechanical pain threshold and muscle function, it has proven to reduce perceived pain arising from exercise-induced muscle soreness. Another form of treatment includes deep tissue massage therapy. Urbaniak et al. Explains that deep tissue massage aims to relieve muscle and fascial tension. This method focuses on releasing the soft tissues within the body. These soft tissues include muscles, tendons, and ligaments. It also focuses on realigning tissue layers as effectively as possible in the areas that are worked on. It also promotes increased blood flow to the tissue, which helps nourish the tissue, increase oxygen levels, and wash away metabolic products after exercise. Deep tissue massage therapy also hydrates the tissues by reducing friction between muscles and between muscle elements and may improve muscle movement and reduce pain. DTM also affects tactile nerve endings, which have a greater diameter and thus transmit signals faster than slow or pain nerve endings. In a study conducted by Urbaniak et al., the results showed a decrease in DOMS for rectus femoris muscle and the gastrocnemius muscle. This decrease in DOMS was only shown in some muscles and not others.
The last form of treatment for DOMS we will discuss is vibration therapy. VT has been shown to bring about an improvement in range of motion, increased blood flow under the skin, muscular strength, power, and development. It may be an effective intervention as a treatment and to control DOMS, while also enhancing performance and by helping prevent injury. VT causes muscle contraction by stimulating muscle spindles and alpha motor neurons. Adding on, sometimes redness may be visible in the post-vibration session in the lower extremities, especially in new users. Vibration is an effective modality in the field of rehabilitation. In the article VT and Management of DOMS, authors Vigar and Imtiaz state that vibration therapy improves muscular strength, power development, and kinesthetic awareness, increased flexibility, and motor unit synchronization. VT therapy also prevents sarcoma disruption, which occurs due to the strain of the eccentric exercise and thus helps in preventing DOMS. It is also more effective than an ultrasound.
Though it is important to know the different options of treatment, there are also preventative measures to consider. Reducing the negative effects of DOMS is important for maximizing training gains. A good approach to take in helping the onset of DOMS is to start training at a very low intensity and progress slowly through the first few weeks. On the other hand, another approach is to initiate the training program with a high intensity, exhaustive training bout. During the first few days, muscle soreness would be high, but evidence suggests that subsequent training bouts would cause considerably less muscle soreness. Hydration may help prevent the effects of DOMS as well. Eccentric exercise performed when an individual is dehydrated may exacerbate the skeletal muscle damage as a result of reduced intracellular water. Eccentric muscle activity with decreased intracellular water during dehydration has been theorized to lead to structural, contractile, and enzymatic protein denaturation. So you can see how important it is to stay hydrated before, during, and even after exercise. Continuing, according to Urbaniak et al., it has been found that wearing compression garments may help reduce muscle damage by up to 26.7%.
In conclusion, it can be summarized that though there is no true understanding of how DOMS occurs, there are multiple avenues one can take to help alleviate the symptoms of DOMS, with treatments ranging from something as simple as icing to treatments more complex such as vibration therapy, deep tissue massage, and acupuncture. According to Myanmar Bashi, due to the unknown pathology of DOMS, the unique alleviating method is not present. Therefore, the effectiveness of therapeutic procedures is mostly dependent on the reduction degree of symptom and signs and the duration of its effectiveness in combination with minimum possible side effects.